Good evening, everyone. My name is Nicole Brown, and I completed this project with my partner, Danelle Oliver. The population that we assessed are older adults, and the intervention that we utilized is narrative therapy within individual sessions in a residential treatment facility. Before I present the information, I wanted to first present some information as to who developed narrative therapy, as well as what narrative therapy actually is. It was first developed by David Epstein and Michael White. Essentially, narrative therapy is a form of therapy that aims to separate the individual or their client from their problems. What this does, it allows the individual to externalize their issues rather than internalize them. So, a part of narrative therapy is constructivism. And what this is we make sense of our world by creating our own constructs of our environment. We relate to the world on the basis of our own interpretations. Constructivism teaches us to look behind behavior to the ways we interpret our experience. This concept then yields the technique of reframing and helping clients find new perspectives on their lives that's taking the focus off their problems. So, when you want to conceptualize separating the client from their problems, narrative therapy focuses on context, interpretation, and reframing. Social construction expands constructivism. While constructivism says we relate to the world through our own interpretation, social constructivism points out that those interpretations are shaped by our context. So, we view the world by our experiences and the things that our social context and our culture and our experiences, it kind of tells us what we should think of ourselves. Whereas narrative therapy, it allows us to reauthor our lives and our relationships, reconsider the things that have affected us, and provides us with rich engagement while retelling our story. In an effort to assess older adults, some things have been taken into consideration. Research shows that substance use disorders in older adults are underdiagnosed and undertreated, despite the fact that as we age, our bodies and brains become more vulnerable to the potential harmful effects of substances. One of the things that's relevant to our study and our treatment of our client is that prescription medication used in older adults, age 60 and older, is nearly twice the rate of the use in general population. So we have to consider that due to some of the physiological changes of aging, there are issues with co-occurring chronic medical diseases and high usage of prescription medications. This again makes older adults particularly high risk for adverse effects of alcohol and illegal drugs. So, when we screen and discuss substance use with older adults, it is important to use non-judgmental and non-stigmatizing language, as they are already faced with their current issues as well as ageism, as well as not being able to identify with certain individuals who provide treatment. So, one of the assessments that we found vital is the biopsychosocial assessment. And this is needed in an effort to diagnose the client from the whole perspective. So we have to consider all of the components from a systems perspective, from a biological perspective, as we understand that mental health conditions can be co-occurrent with substance use, and substance use disorders are diseases of the brain. So while we assess with the biopsychosocial, it gives us a clear picture on how we can best treat our clients. And so, because of this particular scenario with our client having suicidal ideations, we will also use the Columbia Suicide Severity Rating Scale, and this is to assess the level of intake as far as the level of care. If the client scores high on the Columbia Suicide Severity Rating Scale, it is recommended that she starts treatment with inpatient psychiatric evaluation and treatment. Finally, it was recommended that We also use the tobacco, alcohol, prescription, medication, and other substance use tool. The tobacco, alcohol, prescription, medication, and other substance use, commonly referred to as TAPS, consists of combined screening component followed by a brief assessment. So one of the positives of this is this can be self-administered, thus giving the older adult an empowering place in their care. So again, the level of care and recommendation, if suicide ideation or suicide attempts are a crucial factor, the recommendation is inpatient psychiatric evaluation and treatment. And once that has been completed, she can move to lower level care, which is residential treatment facility, a 28-day program in which narrative therapy, in addition to other therapies, are able to be offered. The third level, when she completes training, is intensive outpatient program. This will support all of the coping skills that she has acquired. It will provide her on a great pathway. The aftercare planning will reinforce the recovery habits that she has developed and reinforce the ability to connect with her external relationships. The theoretical framework that we utilize is systems therapy. A couple of points of systems therapy is the concepts emphasize reciprocal relationships between the elements that constitute a whole. These concepts also emphasize the relationships among individuals, groups, organizations, or communities, and mutually influencing factors in the environment. Systems theories focus on the interrelationships of elements in nature, encompassing physics, chemistry, biology, and social relationships. So if you refer back to the case study, you will see that our client has some issues of trauma, also some issues of death, and also issues of estranged relationships. So the thought is to first initially conceptualize some of her behaviors through the attachment theory. But we can also expand upon our knowledge or come up with a theory for our client using systems theory. So one of the techniques and tools that we will utilize is narrative therapy. So narrative therapy seeks to be respectful, non-blaming. It is an approach to counseling and community work which centers people as experts of their own lives. One of the things that we have researched in older adults is their sensitivity to stigmatization. So this is the soft approach that allows the client to be in control of their own therapy and to be experts of their own therapy and their own trajectory. The overarching goal is to separate the client from her problems by objectifying her past stories, framing her problems through the broader social context, as we mentioned before, reframing or reauthoring her stories to yield positive perspectives on aging as well as the future. So some of the objectives of using narrative therapy is that we want to address untold aspects of the client's past into her narrative, have externalizing conversations, deconstruction, reconstruction, recognize unique outcomes from her narrative, and develop healthy coping skills. To expand upon some of those objectives, externalizing conversations between the therapist and the client will encourage her to share her problem through problem-saturated stories. This then allows the therapist to yield appreciation for the family's problems, for the individual problems, by using externalizing language to help support that practice. Therapist separates the client from their problem. Externalization is encouraged. What externalization does, it encourages the client that they are not the problem. Rather, they are struggling against the problem. So when you think about deconstruction, it is a term from literary criticism that entails questioning assumptions. This allows for reconstruction of new stories. Reconstruction is a radical externalizing approach of defining problems not as properties of the person. Rather, this is to reconstruct unproductive stories into productive ones. So, as the client moves on from individual therapy, the hope is that she can reconnect with her family. So, recognizing and talking about unique outcomes, this process is combing through her family's history in an effort to sort out and look for sparkling events that enable them to resist and or behave in a way that is contradicted to the problem of the story. Unique outcomes yield opportunities for counterplots that empower ways of construing events. So while the client is in residential treatment for 28 days, the primary mode of therapy will be narrative therapy in individual sessions, and this will take place at 11 a.m. Additional sessions will be provided as needed. Some of the strengths of narrative therapy is that it is person-centered. It allows for a collaboration, an interactive relationship that is crucial in a therapist and client relationship. So it is also not only collaboration with the therapist, but also eventually collaboration with her family. It is non-judging, which is critical in working with older adults as they have some self-stigmatizing views. And also it is empowering, and what it does essentially is it transforms the problem. The limitation, which I find to be one of the biggest issues, is that trauma may limit the individual's cognitive or intellectual language skills. So what they'll do is they'll rely on the therapist to hold the conversation. So they may not be ready for narrative therapy. The methods of evaluation of the intervention are ongoing. So initially, we would complete formative evaluations, and this is done through the biopsychosocial. We are first learning about the client. We are first learning about where they are cognitively, mentally, and as far as their sobriety, and as far as their unmet needs. So we're evaluating, we're having a starting point through formative evaluations. So throughout the treatment, which will be ongoing until discharge, is we're going to assess the readiness of the participant using the readiness scale. And there are 5 stages in this. It's pre-contemplation, it's contemplation, preparation, action, and maintenance. So concluding the individual's treatment, we would do a summative evaluation. And this is usually done through a questionnaire, which is a quantitative approach. And we also do this through exit interviews. And this also encompasses the readiness for change scale as well. And that is a qualitative evaluation. So here's our prognosis. The thought is, by us taking a holistic approach and recognizing the client's ecological factors and experience in addition to their personified stories, narrative therapy in addition to inpatient treatment will provide the best chance for a successful recovery and development of healthy coping skills. By recognizing the client for their unique experiences, we think that treatment will be effective because it would address not only the physical aspects of addiction, but also the mental health, the co-occurring diagnosis that the individual has, also the social and emotional needs. This includes addressing co-occurring psychiatric issues, substance use, and trauma. The client will be able to mitigate away from stigma, address family issues, and develop healthy relationships. So we found some interesting empirical-based practice, narrative therapy for treatment and intervention. Researchers and scholars have explored the use of narrative therapy with older adults who have a lifetime of stories to share. So during an experiment, also it showed that older adults with depressive symptoms, in which our client has, displayed significantly less depression symptoms and higher levels of mastery after participating in a narrative therapy intervention. Narrative therapy is a great tool in clinical social work for older adults.